uh, because of the efforts of Pam and other people who are across the country who make sure that these kits are available and free for people to use. So I'm going to talk a bit about what radon is, the impact it is on people's health, and then Pam will talk more about how to fix it and the 100 Test Kit Challenge. Next slide, please, Pam. Oh, sorry. Did you do the land acknowledgement before I got on?
I did not. Yeah, that's right. So we are, Take Action on Radon is proud to connect people from across Canada, and I am joining from Treaty 1, so I'm glad to be able to come in, but I'm in Winnipeg, coming from Treaty 1 territory, home of the Anishinaabe Cree and Oji-Cree, and we are grateful to be able to share and use the resources of this land. So thank you for that, Anne-Marie.
And I'm calling in from the Squamish, Tsleil-Waututh, and Musqueam peoples in East Vancouver this evening. So I'm a professor at SFU. My area is cancer prevention. And about 15 years ago, I started a project that looked at what are the things in Canada that people do that cause cancer, and what are the things that people who develop cancer, what kinds of cancer do people mostly die of? And what that research did was galvanize my interest in looking at the non-tobacco related lung cancer carcinogens. And to my surprise, I learned about this gas that I'd never known about until about 15 years ago. And I spent 18 years studying to be an epidemiologist. And what I didn't know made me realize that many people don't know about radon gas. So if you have never heard of it or you just heard the word, you are not alone. Statistics Canada assesses knowledge of radon every few years, and we're about 40 to 50% of Canadians now know what radon is accurately, but it's still an underappreciated carcinogen, and it's actually the leading cause of lung cancer in non-smokers. And then if you do smoke, it's the second cause of lung cancer in smokers. So smoking plus radon together is really problematic. And in BC, we're in an interesting place because so few people smoke now, tobacco anyway. And as a result, we're actually still seeing high rates of lung cancer, and women now outstrip men. So 30% of the people in the cancer cohorts now have never smoked. And what we've learned over the last 15 years by testing programs here in British Columbia is that BC, once thought a place where there wasn't any radon because they only dealt with Vancouver, is actually a very radon rich region. So there are parts of this province that have some of the highest radon levels in the country that I've seen, maybe outside of Quebec. So the fact that we are testing, we're learning more, and we're learning more about the people who may be exposed who may go on to develop cancer. Next, please, Pam. Sorry, that was a wordy bit of business. So radon is designated as what's known as a known human carcinogen, and that means that the evidence that has been used to say that it causes cancer is very clear. Interestingly, it was Canadian miners who worked in uranium, hard rock mining, and fluorspar mining. It was their workplace exposures that helped contribute to our understanding that radon does cause lung cancer. So it's not even up for debate. And it's chronic inhalation, so it's not necessarily drinking it in water, or if it's in food, but it's in the air. It's chronic inhalation. And Health Canada has done some statistics, and the estimates are that about 3,000 Canadians every year will die from radon-related lung cancer. That's about 9 people a day. Next, please. So I talked a little bit previously about radon and smoking. So the co-exposure of particulate matter and radon gas exposure increases the risk. So if you live in a high radon only home, your risk of developing cancer is 1 in 20, and that's pretty high. But if you smoke, it's 1 in 3. And the reason why we talk about this explicitly is that if you're someone who has smoked a lot in your life or you are a smoker, you know that it's hard to quit smoking. It's much easier to test for radon and remove it from your house, and this will significantly reduce your risk of developing lung cancer. So radon and smoking don't mix, and it's much easier to quit radon than it is actually to quit smoking. Next, please, Pam. So in Canada, we have a guideline level of something called 200 becquerels per meters cubed. And that's just a fancy way of saying how much radiation disintegrates in a cubic meter of air. Again, this is an inhalation exposure. The recommended level is 200 in Canada. In the US, of course, they use different metrics. They use a picocurie, but when you calculate that into a becquerel, it's about 150 becquerels, and the WHO uses 100. You may ask, why is there a difference? And that's in part due to regulatory policies by governments, and the recognition that Canada is actually a radon-rich country. And in some cases, there's quite a bit, and getting levels down to 200 was considered protective enough. So if you get a test result that's between 100 and 200, we do often point out that other countries regulate this in a different way. But regardless, if your radon level is over 200, you're going to want to take action to reduce your radon levels within 1 year, because for every 200 becquerels or more, it almost doubles your risk of developing lung cancer. And these are some of the statistics. So you can see that if you're a non-smoker, your risks are, what we call statistically low but significant. But if you are a smoker, you can see how much higher your risks are. So if you are either a past or current smoker, a heavy past smoker or a current smoker, and you have radon levels of 600 and above, your lifetime risk of developing lung cancer goes up quite considerably. And I'd like to say that there are a few homes over 600 becquerels in BC, but that's not correct. There actually are quite a few that are above that level. And I'm going to talk a bit later about a new program that we have to help protect people's health around that. So Canadians are exposed to radon, again, mostly from indoor air, and that's inside homes. So radon gas is part of the natural decay chain. I didn't talk about this, but where does it come from? It comes from the earth. It is, technically a natural hazard, but we build buildings, and we build buildings that sit on the ground, and there's uranium across British Columbia. And as uranium, which is radioactive, breaks down, it's a metal until at one point it's a gas. And the thing about gases is they don't stay where they're told to. They like to move around. They like to go from places where it's cold to it's warm. And so the gas moves through the soil and can go up into spaces above, like homes. And in fact, homes can actually draw air up because they're warm and the ground is cold. And the gas is drawn up through fissures in the soil into gaps and cracks and goes into homes. And over time, the levels can build up. Radon likes to go through cracks in floors or walls or sumps and drains, anywhere there's an opening. And as a result, the levels are generally highest in the basement and ground contact rooms, although we have seen elevated levels on the second floor. Sometimes it has to do with how a house is heated and how the HVAC system works in different homes. There is an issue of whether or not radon gas can enter well water, and it can be consumed, but the health effects of consuming the water are far different than the health effects of actually inhaling radon gas. Next, please, Pam. So where is radon a problem? Where would you encounter it? Basically anywhere that's built on soil where there's enough uranium concentration to be releasing radon gas. And that's actually pretty much anywhere in Canada. Some places have more uranium than not, but you don't know until you test. And sometimes houses right next to each other, one can test low and one can test high. So radon can be a problem in homes or schools or really any building that has contact with the ground. Next, please. The only way that you can know, so radon is unfortunately an odorless, colorless, tasteless gas. So it makes it really hard to be able to guess whether or not you have radon in your home. And just because your neighbor tests high, your house may be used very differently. You may have different ventilation. The slab might have been different on your home, or the age of your home might be different. So the only way you actually are going to know is to test your own home. But it's very easy to test. And tonight you're going to get the 91-day tests. And these tests are actually the most accurate. They don't look like much, but they are actually the most accurate way to test your house for radon, and actually the most economical as well. Next, please. And the reason that we test for 91 days, you might think, wow, that's a long time. And that's because radon levels ebb and flow or wax and wane sometimes over the day. and sometimes by the hour. So I have here in East Van, I have a digital monitor that I run in my home, and it can go from 40 to 80. Yeah, so it doubles depending on what's happening in the house, if fans are on, or if it's hot outside, or the door to the crawl space is open. Lots of things can influence the radon levels. So as a result, we want to make sure that we actually test for 91 days. And this is how we differ significantly from the United States. They actually allow people to test for 2 days. But you can see here on this chart that if you only tested for 2 days, you might have a false positive by assuming the levels are too high, or a false negative by showing levels that are too low. So we recommend that people test for about 3 months in a place where people normally spend time, like the air that you breathe, not the air in your crawl space, to make sure that you have an accurate understanding of what the average levels are that you're exposed to over that period of time. Next, please. So the detectors that you will use today, they look kind of like a square hockey puck. They're a bit smaller than a hockey puck. And they are, again, the most accurate kind of testing device. They have a piece of plastic inside, interestingly, that as the radon gas goes through, it emits an alpha particle and it makes a pit on the plastic. And then the plastic is read by a machine in the lab. So we follow quality assurance measures to confirm the accuracy of our test devices. There are other ways of measuring radon, including digital monitors, but they again are less accurate than these small plastic devices. And so you will get a number after you finish testing, you'll get a number mailed to you individually. And you say, well, what does that number again actually mean? So if your level is between 0 and 100, this is considered low risk. If the radon level is between 100 and 200, then you need to think about when and how you tested. Was it realistic to the exposure that you have? Was it close to 100? Was it 199? That's not a reason to cheer. Or was it 120? Anything over 200 is where we really recommend that people start to consider testing or fixing their homes. Historically, the government has suggested that you fix something over between 200 and 600 within 2 years, and anything over 600 immediately. But we are shifting this messaging as we're learning more about what radon can do to lung health. We're really encouraging people that anytime your levels are over 200, you really consider radon remediation, which is a system which Pam will explain more about, that actually helps draw the gas out of your house and reduce your exposure. I'm the nerd and she's the practical building person. So part of the work that I do in my nerdly context is I help at the BC Centre for Disease Control, where we are the only province that has an actual living map of testing in BC. So you can go on your phone. It's been optimized for cell phones now. It's a free publicly available resource called the BC CDC Radon Map, or Radon Data Repository, the RDR. And this map allows people to look and see what testing looks like in their region. You can see how many homes have tested, which often aren't many. And you can see the proportion of homes over 200. The redder homes in this map are where more than 30% of homes are above 200. And there's parts of the province that are gray that we haven't managed to test yet, so we're still learning about. And this is actually a living database. So as people are testing more, their data is anonymized and it's provided to this system, and it builds up the database. So the more we know about radon, the better we can optimize policy and encourage people to, again, provide remediation services in places where we know that radon levels are high. And you can look at this through municipalities, you can look at it through health regions or local health areas. As I mentioned earlier, we are seeing a significant number of people developing lung cancer who are younger, who are women, and who have never smoked. And as a result, there is an opportunity at this point in time in Kelowna and in Vancouver, if people have elevated radon levels, so if your level comes back over 800, you may be eligible for a free low-dose CT scan. Right now, you can get a CT scan if you're a smoker. However, we know that people who don't smoke are getting lung cancer. And what the low-dose CT does is it is a very quick snapshot of, you go through the machine and come back. I went and did it myself. And was simple. And what the results are is they can tell you if you have nodules, growths, or the beginning of cancer in your lungs. It's called a lung health check. And why this is so important is we're trying to learn whether or not we can use these devices to make sure that we can catch people's lung cancers early. The only way, really, the best way to survive 5 years with lung cancer is to have your cancer detected early and have treatment as a result of that. And the problem with non-smoking lung cancers is that people don't get diagnostics. And then unfortunately, by the time they end up in the hospital system, it's stage 4, and then that's the end. So the sooner that we can understand whether or not people have damage in their lungs, the sooner we can address it. And this program is the first in the country to offer this. And so again, if you know of anybody who has tested above this, it doesn't have, it could be a digital test even. There's a call number to call. I'm happy to talk afterwards with people, but it's a free low dose CT screen. I think that's the end for me, Pam, is it not? I think so.
Perfect. Yeah, thanks
Okay,
so much,
thanks.
Anne-Marie. All right, so the good news is after you test, we do have resources to help you if you do need mitigation. So you can go on the CNRPP website and find a professional to help you with mitigation. And typically, mitigation looks like this. If the pipe goes up and out and there's a fan that's added to it, it looks really simple, but it does need to be installed correctly. And what happens is the pipe goes down into your space and goes up and out. And so it provides that pathway for the gas to go from beneath your home up and out of your home. And the fan needs to be properly sized for your house. And then also it needs to be installed in the right location because we want it to draw air from the full footprint of the home. So here's a couple of pictures of typical mitigations. Oops. And the other good news is that there is a national mitigation grant. So the Canadian Lung Association does have a grant to help with those that may be low income. They can provide, it provides $1,500. You do need to apply before you start the work. You do need a quote from a CNRPP professional, but you can find information on their website. And then the other thing that's important to note, in BC, radon is included in the building code. So there is a requirement for a full passive pipe now. It started in about 2018 and then rolled across the whole province eventually, but that provides a passive system. So then you would just need to test your home and determine if you need to add the fan. Okay, so that's sort of some basics about radon. As Anne-Marie said, feel free to put some questions in the chat and we'll answer those. And I'll just walk through some of the details about our program for you with the 100 Test Kit Challenge. So we have 5 easy steps for the program. First is you pick up your detector. So I'll talk about where you can get that. So for those in person in Burns Lake, you can pick it up tonight. But for those that are watching online, you can go into your pickup location and pick it up over the next week. And then you do need to match your serial number with your contact information. And so we do have a way online. So you'll see in the instructions, there's a QR code or a website. So you can go on there and start the test. If you have challenges with the internet or the web page, you can give us a call. And so feel free to reach out to us if there's any challenges, but we need to know the day you start it. And then you'll leave it in place. And then after about 100 days, we want at least a minimum of 91 days. So we'll talk about 100 days just to help make sure you get that minimum 91. But after that, you'll return the detector. So when you pick up the detector, you take it home, you want to find a location to put it. So think about putting it in a room in your home. So think about your basement first. If you've got a basement, pick a bedroom or a home office. If you don't have a basement, then choose a location in your main floor, again, a bedroom or a home office, and put it up on a shelf or a table. And then once you set it up, then you can go on and click the start survey. And then there's some questions to answer. We need your contact information as well as your address, and then also the serial number. And so there's some fields that are required, and those ones we need in order to get you a report. And then there's some that are optional, and those are housing survey questions. So you can feel free to answer some or all of the questions and then set them up. For some of you, you'll get two detectors. And so we test to make sure that these detectors are accurate. We've done this over the last 7 years. And so we know they're accurate, but we're always checking. So some of you will get two. And so we ask you to just put those, open them up at the same time, put them side by side, and then drop them back off at the same time. And when you go to record the start and the end date, it'll ask you if you have two to put in the second detector. And so you can just record both serial numbers there. So that's starting the test. Once it's set up, then they stay for the 3 months. And then at the end of the period, then there's a collection period. And so the benefit of being part of this program is we're all doing the testing at the same time. So you start together and you end together, and then you drop it off at a location, and there's no cost for shipping because we'll just ship them all together to the lab from the drop-off locations. So after that, then you will receive a report. So it'll get emailed out to you typically 6 to 8 weeks after you've dropped the kit off at the drop-off location. And that will tell you what your radon level is. So this report is just confidential between you and the radon test. But then what we do is we summarize the information and we publish a community report. And so here's a couple examples of community reports that we've done across the country. To share the data, we'll share, how many homes participated, the percentage of homes that was above 200, and then you can see we also share information about, how many were below 200 in the different areas. Okay, so for you that are participating today, you can pick up your kit starting tomorrow. So if you're in the city of Langford, you can pick that up from City Hall between the hours of 8:30 and 4:30. And if you're in Burns Lake at the village office, then you can pick that up. Or if you're in Burns Lake, you can pick it up from the village office. And then it's the same locations when you go to drop it off. And so the drop-off week, as you can see, is in February 2nd to 6th. And those dates are on the envelope. So when you pick up detector, it'll be in an envelope, and the information for your location and the dates will be on it. Okay, so I'm just gonna call on, oh, right, before I do that, I'll just give you a couple quick announcements. We actually have a contest running to raise awareness, and so we wanted to share that information. So if it's called November, a play on the word no, and the fact that November is our Radon Awareness Month. So we're asking people to learn about radon and share what they know, and then you can enter a contest. So you can even take a picture of yourself listening to this webinar or telling somebody else to go pick up a kit that you're, and then enter. You can go to the website and enter it. And we have some fun prizes there that you can win. So you can check that out as well. And then on that same website, there is a radon game. So if you're curious to find out more about radon, you can play our radon game and travel around our little virtual community. And you can, it'll ask you questions and you can answer yes or no and test out your knowledge or learn as you go about radon. All right, so I'm going to get Sean from the city of Langford. Thanks so much again for joining us, Sean. Do you have any instructions for people as they come in to pick up the kit?
Yeah, it should be very simple. We're just up on the second floor. Most people in Langford know where we are, right down Central Goldstream. So if any of our Langford people want to come up and just have a chat with reception, they will direct you to building and we'll get you all sorted out.
Perfect. Great. Thanks so much, Sean. And Lena, I know you're in person in the council chambers. Do you want to share any instructions for people coming and picking up the kits?
I'm gonna do it because she's been the lead on this project, so. Hi, so for our kits, it's gonna be quite simple as well. Residents will just pick them up at the village office. You're on 15 and 3rd Ave. We're open from 8 a.m. to 4 p.m. So it'll start tomorrow and then it'll be all next week as well.
Perfect. Great. Thank you so much. Okay, so now we'll go to questions. So I'll just check in and see, Anne-Marie, do you have any, have you been checking in on the chat?
I was asked about other health outcomes besides lung cancer. And, this is an interesting question because the reality is that these were men who worked in mines where they saw the first health effects coming out of their exposure to radon gas, which again is radiation exposure. So that was really the only group at the time that were studied for exposure. And as time has gone on, people have asked this question of like, maybe there's other things that radon gas causes. And because it's an IARC1 carcinogen, there's a lot of policy that goes around reducing exposure to IARC carcinogens. And as a result, not a lot more research was done until recently. Also, lung cancer is one of those relatively neglected cancers because there's been a lot of stigma with smoking. And as Pam can tell you, we get calls a lot from people who say, oh, I have lung cancer, but why? I'm a healthy person. I do fitness. I don't smoke. Like, why have I developed this cancer? And as a realization of radon has come along, there's also been more interest in looking at other cancers. So there are, if you look into the medical research, you will see studies relating radon to lymphoma and leukemia, which makes sense because these are the other kind of radiation-related cancers that can occur. There are also studies of pregnancy looking at fetal outcome, also tracks with what we know the impacts of exposure to radiation are. So far, the evidence for those outcomes is nowhere near as clear as it is for lung cancer. And that's partly why we talk mostly about lung cancer in this program, is because that's what we know for sure. And it's also one of the least survivable cancers and the leading cause of cancer death. But it's not to say that radon doesn't cause other things. We just don't have the evidence yet to say with certainty. And in this program, anyway, we like to be certain about the evidence that we're speaking about.
Perfect.
Thanks.
Thanks so much. And then another question that we have is, so Lydia, I'll just get you to go through some of the guidance that Health Canada has. So if somebody is wanting to test in a building other than their house, Health Canada has, you know, in a house you need just one kit, but in a public building you need more. Do you want to just talk briefly about if somebody was testing their workplace, what it might look like?
Yeah, so there's different guidelines depending whether it is your workplace, whether it is a school or a daycare. So depending on which building we're talking about, we have the guidelines on canada.ca/radon. And we have some really good guidelines that our team has developed on testing these buildings. So federally, if we're testing a federal building, there's standards for that, and that has actually been completed for all Canadian federal buildings. So you can look that up on the website as well. Yeah, so it really kind of depends on what building we're looking at, but we have developed guidelines for different buildings and they're all on the website.
Perfect. Yeah, good. Thanks. And there is some questions too about schools. So we know in BC there has been schools. Do you want to just talk about some of the schools that have been tested?
Yeah, so I know that in the interior, all the daycares have been tested. And then in terms of the elementary and high school, they've tried to test most of them. And I believe that most of the school districts have opted to test already. But it is also something that is not mandatory. So the few that haven't been tested, I know that in those jurisdictions, they're working really hard to get those schools tested. But there is also that question of if it is tested high, then what is the logistics with mitigation and the funding there? So that's kind of where we're at in terms of testings in schools, but it mostly is focused in the interior because that's where the levels are the highest.
Yeah, sounds good. Good, thanks so much. And then another question, Anne-Marie, I'll throw this one to you. So just about any concerns about pets. So we have talked about lung cancer in people, but are we seeing this at all in pets?
Pets can get cancers from these types of exposures. In fact, they used to use beagles long ago to look at the relationship between radon gas and tobacco exposure and lung cancer. Well, in this case, they get snout cancer because dogs breathe a bit differently than humans do. But Pam also gets calls about, you know, my pet died of lung cancer, and is that weird? And so we often encourage people to test their homes if they suddenly had an animal that has died of lung cancer, because often our cats and dogs they stay in the house all day or for most of the day. And so they're kind of the sentinels in our homes of what the indoor air quality is. So yeah, if you have a furry friend that lives at home, or you know people that do, you might also want to encourage them to pick up a test, because this is a great opportunity to know what the levels are inside.
Perfect. Thank you.
There's a question about mobile homes, Pam. Are all homes eligible to be tested?
Yeah, good question. So yes, theoretically, radon comes in through contact with the soil. So usually we think about mobile homes being up a little bit and there's a bit of a gap, but sometimes these gaps are really well insulated. And so it may have radon or it may not. So we encourage everyone to test. So even if it's a mobile home and you're not sure, you might as well still go ahead and test it.
Thanks.
Yeah. Another question is about heat recovery ventilators. So the HRV or a heat recovery ventilator that is in our homes could have a way of reducing the radon levels. However, it would be a percentage. So the way that they work is they bring in fresh air and they discharge that fresh air, they discharge the conditioned air from the house out. And so if you had high radon levels and then had an HRV installed after you tested, then it may have some level of reduction, but often we reduce it using a mitigation system, because that is the lowest, the way to reduce it the most. But if you have a mitigation system already installed, then you may want to consider getting the HRV balance, because what we do find is that those filters get clogged, and then it can decrease the amount of fresh air that's coming in your home, but the same amount of air is still being drawn out, and then this can depressurize the house. And when the reason that the radon comes in is because of a difference in pressure. So when your home is under negative pressure and the ground is a positive pressure in comparison, it tends to draw more air, well, it draws the air in, and as that increases, it draws more air radon in from the ground. So so if you do test high, this might be kind of one of the first steps, is to balance and maintain your HRV, and that could really help. All right.
I have one to add to that. So in the last few years, I have had the pleasure of working with Dr. Noah Questel at the BC Lung Foundation on a project where we looked at whether or not energy efficiency retrofits impact radon levels. And what we've learned that is when people tighten up the envelope of your home, so it stops releasing heat, it also stops releasing gases. And so if you are planning to do a renovation on your home, or you have recently renovated your home, it might be a good idea to check the radon levels for that reason alone, because we know that sealing up a home can trap gases and increase radon levels. And a lot of this was research that was even done in Canada in the 80s, when they were first starting to talk about energy efficiency and everyone had single paned windows. So the more energy retrofit things you do, actually, the higher the radon level can be. So it's just another important consideration. If you spend a lot of time in your basement in a home office sort of situation too, and you're sealing things up for that, that would be a great place to test. I don't know, Pam, if we've talked about where the best place to put the Radon Test Kit is. Yeah. So if you have a home office in the basement, that would be a good place to consider testing if you spend a lot of time in the basement.
Yeah, for sure.
Okay.
Good. Okay, Lena, maybe I'll take a minute and see if there's any questions in person there in the chamber office.
Yep, you have one. I have one. I just wondered, I know you talked a bit about larger, like, schools and larger buildings. Is there a house size that a person that's big enough that a person may want to test in 2 spots or anything?
Yeah, good question. So typically we recommend 1 test in a residence, but it is not unreasonable for a large footprint that you may want to have 2 tests. I would recommend if you happen to have 2 different heating types, then that might be a situation where you want to do multiple types. So it could be that you have different heating zones in the house because of the size of it, or sometimes people just add additions on, and one will be heated by one thing and then the other area will be heated by something different just because of the way that the addition was added. In that circumstance, I would recommend putting 1 test in each kind of heating zone area. But typically the air moves around. So if you've got a forced air heat in the house, you know, 1 test will give you a good idea. You know, it may vary a little bit in certain areas, but one will at least give you a really good an idea of what the radon levels are. Yeah, thanks for that. Any other questions?
Lauren,
Nope. Okay. All right. Good. Anne-Marie or Lydia, any other points that we haven't brought out yet, or any questions that you've seen so far in the chat?
I just would like to encourage people again, like we're not, hoping that people have levels over 800, but if you do know of someone who is tested high for radon, I can't strongly urge you enough to encourage them or to follow up with that low dose CT screening study. We really need to stem the tide of lung cancer death in this province. And stopping smoking, that we thought that was going to be the ticket, but it doesn't seem to be the thing that has really made a big difference. So, cancer rates in general are starting to come down, but they're just not for lung cancer. So anything that we can do to reduce anybody's risk of developing lung cancer, smoker or not, I just please encourage people to test. You are all now radon ambassadors. You know more about radon than most people do. So please go out into the world and talk it up and encourage your neighbors to test, because this one thing could save somebody's life.
Yeah. Yeah, all right, thank you. So just a quick reminder, when you get the test, you can pick it up, take it home and set it up. There's all the instructions are in that envelope. There's a little checklist on the outside of the envelope. Our contact information is there too, so if you do have any questions, you can certainly reach out to us by email or phone. You're just at the front end of our launching our program, so it's a good time to call us as we get into November. We do sometimes get busy, so it takes us a bit to get back to you, but we do try and get back to everybody. Yeah, we really appreciate you participating in this. Oh yeah, and there are still kits available. So both communities, as I checked, I think there was still more free kits available. So encourage your community members, your neighbors, to sign up for a kit. And so, yeah, they can drop in and pick up the extra number of kits at those pickup locations. All right, well, I'll just take one last chance for any other questions that maybe somebody's thought of.
And we're always here. So if you have questions, we even have someone who answers a phone or will phone you back, believe it or not. So because we've realized that there are people who don't necessarily always use the internet for different reasons and don't like it and don't like email. So we have a phone line. We encourage people to use it because we actually use it too. And yeah, no question is too weird or small. Believe me, I'm sure we've been asked, although if you can find a weirder question for me, I'd like to add it to my list of things that people ask me about radon. So we're not far away. We're here to help.
All right. Well, thank you all. We really appreciate you taking your time to learn. We will, wish you a great night. And we will hear from you throughout the next 100 days. All right. Take care.
Good night.
Thanks so much, everyone.
Bye-bye.
Bye.